Good day, ladies and gentlemen. I am Edeh Chidera, also known as Zeus. I am the Treasurer of Enugu State Medical Students Association, otherwise known as ESUMSA. I am glad to welcome you to the very first session of the online webinar series called Global MedPathways with Zeus. I know most of you are hoping to expand your medical expertise beyond the borders of Nigeria, but you have not the necessary information needed to achieve this. I am here today and me and my guests are here to lead you through that. But I can assure you that you're in the right place, and after you're done here, you're not going to regret attending this seminar. Now, I'm going to introduce my very first guest, my very good friend, and my mentor, Dr. Obinna Arinzonya, who is a medical doctor in the United Kingdom, but has also practiced in Saudi Arabia. Another interesting fact is that he was actually the course rep of his induction set. That was in 2017. And ever since then, he has mentored most of his junior colleagues to get to this stage. Dr. Obinna, how are you doing?
I'm very good. I'm very happy with your invitation. I mean, when you told me about this program, I was really impressed. This should be one of the first of its kind. Keep it up, and hopefully we should have a very good discussion today.
We thank you, by God's grace. All right. So let us get ourselves familiar with you, sir. I know I'm familiar with you, but the rest of us, not so much. You know, you're a legend. You're not present at the moment. Yeah. But it's to be very good. All right. So I'm just going to ask you a few questions about the background.
All right. So as a way of introduction, I'm Arinzonya Obinna. I entered Enugu State University of Science and Technology in 2009 and graduated in 2017. I didn't have 5 distinctions or 7 distinctions. I was just your regular medical student who was incidentally also the class rep of his class from 2015 to 2017. And that's about it. Here I am today. Working in United Kingdom, so no big deal, no biggie.
You sound very, very, very modest, sir. Although we recognize it's a big deal.
I mean, it's not, why I use that specific word, just your regular medical student, because truly I was just your regular medical student. And if I could achieve whatever I've achieved today, I'm sure every other person, because there's this common saying in medical school that, your average medical student is always above average. So I believe that, for us to be at whatever level we are in now, I believe that most of us should be in our 400, 500, and maybe final year. So for us to have gotten to that point, it means we are definitely above average, and it's doable. I mean, trust me, it's very doable. There's no big deal. It's just the same old pattern, which is hard work and dedication. And I mean, you should be able to attain whatever goals you have.
Wow. Very, very inspirational, sir. I really, honestly. Well, you said that you came into Parkland in 2009. What led you to medicine? And why Parkland in particular?
Well, what led me into medicine? I would say inspiration. Some of you, you would know that my mom is a medical doctor. So she was, while growing up, she was always an inspiration to me. I wanted to, be like her, follow in her footsteps. And so the decision was just very easy. I decided to become a medical doctor, because I had someone I was looking up to and decided to follow, her steps. But that was just it. And then coming to the second question, why ESUMSA? Well, ESUMSA, at the point when we were all filling in JAM, most of us at the time had on the average, almost 80% of us at the time had UNN as our first choices and second choices and all that. if we are being honest, but
yeah.
as at the time, now it's a little bit different. I mean, you have people. ESUT has grown so much from the time we are in there till now. But ESUT was always incidentally, ESUT was always my first choice. Maybe because it was more to me like more of a comfort zone to me. I had my mom, who was a lecturer at the place, so it was always a first choice to me, and that was how I landed in ESUT.
Okay. Well, we don't need to get into too much of the details in medical school due to we know how it is already, stress and everything. Although we would just like to know, how briefly, like, how was the house job?
Well, house job, I would say it's just like it's not something that's above anybody. It's something that is very much doable. I did my house job in UNTH between 2018 and 2019, and I mean, house job is the most important part of a medical doctor's life, if I'm being honest, because that is the point where you actually imbibe whatever you have learned throughout your years of medical school. I mean, you've gone through trainings and all that. You've done your clinical exams. At the point of house job, you are now a doctor, and it is expected that, certain decisions must be carried out independently. I mean, you meet a patient who you suspect to have meningitis or whatever the case is. It's expected that you are now a doctor. It's no more I present. This is the point where you actually have to act on what you've been presenting all these years. So give or take is just a fundamental part of medical training. Unfortunately, I was fortunate to do it in one of the most supported places you would ever do it, which is in UNTH. Yeah.
Okay, well, you've said so much about this house job and you have done it in Nigeria. I just wanted to know, what was the moment that made you feel that you need to broaden your horizons and move elsewhere?
Sorry, come again. The point I felt I needed to leave the country, right?
Yes.
Yeah. Well, I would say at the point of my house job, really, sometimes when you everything is not. I mean, passion plays a big role on us being a medical doctor. That's the truth. But sometimes everything does not border on passion. Passion is not going to put food on your table. Passion is not going to pay your house rent, and all those things. At the end of the day, you still need funds, So it was at the point of house job, because you could imagine as a medical doctor, despite societal expectations, normally the society expects that you're a doctor and that you're a multi-millionaire. They don't usually understand. I mean, when you, as a medical doctor, you tell a relative or a friend that you don't have money, they think you're a joker. They think you're lying. They expect you're a medical doctor and you should always have money. Are you there?
Yeah, I'm still here.
Good. So they expect that you always have money. So at that point during house job, I noticed that, just like I said earlier, certain things were difficult, because at the time, I think our salary was about 170 something thousand naira as a house officer. And by the time you fill your car and, get your meals and everything, you find out that, you don't have anything much. And then again, secondly, the working conditions wasn't, something, it wasn't top notch. It wasn't, we had very poor working conditions. And that was the point really that I said, no, I don't think I'll be able to, continue doing medicine back home. And I started making the required move to, travel out.
That's very interesting. Because of this your time in UNTH as a house officer, how did you know that the Saudi Arabia were accepting doctors? How did you get to know that information?
Well, we've always, most of the information we get as doctors are always information from our predecessors. So we've always, from our seniors, the older sets, who we had some of them who had left for immediately after their house jobs, left for Saudi Arabia, and they passed on this information down across to us, and that was the point we started looking at it.
Okay, so it was based on information from being close with your senior colleagues, so they passed on that knowledge to you.
Exactly.
All right.
Exactly.
All right, folks, take note of that. Be friends with your seniors, and probably some orientation and OT will be coming down to you now. So, are they still accepting anybody? Like, I know there was a influx, but now are they still trickling in, or is the massive influx still happening?
Well, you're right. Between 2019 and sometime in 2021, there was really a massive influx of medical doctors going to Saudi Arabia. But between 2021 and now, there's been they still advertise once in a while, but they now have, because at the time the problem with Saudi Arabia was that they were very limited in the number of indigenes who were doctors. So, but in the past few years, they've been able to graduate a lot of indigenous doctors, and then who are now coming into the profession, and therefore it has drastically reduced the amount of adverts, they are giving out to doctors. So you're right. The amount of doctors going into Saudi Arabia now has reduced because the amount of adverts has also reduced. So that's just it.
Okay, it's just all about applying. It's no more them sending out the adverts anymore.
Well, you without an advert, you cannot apply. So they have to send out an advert. You have to see the adverts, and then you apply, and if you're lucky, you get in.
Okay, you spoke about applications. I want to just know, what are the qualifications that you need to make before you could be eligible to apply?
MBBS. Everything you're doing in this profession is your MBBS. So that's required qualification. That's at the time you graduate and you get your license to this practice. After house job. Before house job you're given the provisional license, but after house job you get your full registration to practice. After that you can apply for anything in the world. There's no other extra qualifications that you'd need. Just your full registration, and that's it.
Okay, so there are no special exams for the Saudi exam, for the Saudi application.
There used to be. What happened was that during our time, or a few years before that massive influx, what happened was that they used to conduct exam about once or twice. That used to happen in Lagos every year. But during the time of just that time frame that we gave, 2019, 2020, 2021, it was all about people applying, and then they come down to Lagos and conduct interviews. So it wasn't now there was no exam you had to write to get in. So it was all about interview, and then if you pass the interview and you're given a job, when you get to Saudi Arabia, it is expected that within 1 year you should have passed their licensing exam. So that was what most of us did. We had the interview, and when we moved over to Saudi Arabia, we wrote their licensing exam and then got their full registration to practice.
Okay, you spoke about this licensing exam. Is there a particular curriculum they use?
The curriculum is just exactly everything you've done in your medical school. It revolves around that. Especially your clinical aspects. That is your pediatrics, 1G, medicine and surgery. Then a few anatomy and a few physiology. Biochemistry as well. So, you have to just be sound during medical school, because most of these exams, and at the end of the day, the foundation is from everything we've learned in medical school. There's nothing new. There's no new curriculum. It's just about everything we've learned in medical school. That's what you require to write and pass most of these exams, be it PLAB 1 or PLAB 2 or whatever, USMLE, is still your knowledge from medical school.
Okay. How did you get there? Did you also have to pay your flight ticket and you just got in and you got entered the hospital? Or the hospital recommended it to a particular hospital? Like, what was actually the process?
So the process was, like I said, there were applications. We came to, because the Ministry of Health in Saudi Arabia, they run and, they are not independent. They are all connected to the MOH, Ministry of Health. So what happens is that, different hospitals send out the number of doctors that they need, all right, from different regions. So they send out the number of doctors that they need to the Ministry of Health, so that when you go through these interviews that was conducted in Lagos, you can now be given contracts to a particular hospital. Do you understand? Different depending on it's luck. It's luck. They do the posting process and everything, and so they just post you to whatever hospital you're going to work in, and then you arrange your flights, money, everything, and travel.
Oh, okay. Because most people would assume that it's an all expense kind of situation in traveling.
Well, it's not really all expense, especially that initial one. But subsequently, when you get to Saudi Arabia, you're now a full-time worker and all that. They usually give vacations, about 60-day vacations every year, and those vacations are all expense paid. Flights. What I mean by all expense, I mean your flight. They give you your flight tickets to and fro wherever you're going for vacation, and most people go back home during their vacations, so they pay your flight ticket to Nigeria and back. So that's the part that they come in. That's the part where I mean, all expense paid.
Okay. Well, you have told us how you got there. Do you have any advice based on your experience on the easiest way to get there?
The advice I would give the younger sets is to work your way through to United Kingdom, United States, Canada, and Australia. Saudi Arabia will not be in my. If I'm to grade it from A to B, if the likes of the US, the UK are in A, I'll put Saudi Arabia as B. It's not somewhere that should be first choice if you have other options. All right. Most of us who went to Saudi Arabia, or most doctors who went to Saudi Arabia, went there to, raise funds to be able to write, because some of these exams you require to get into the US and the United Kingdom are very expensive. So it was cheaper and faster to get into Saudi Arabia compared to these other countries. So what most of us did was to use Saudi Arabia as an alternative to, make enough funds to be able to travel to these other A-list countries. So if, you come from a comfortable home and all that, I wouldn't advise, personally, everybody have their own opinions anyway, but I wouldn't advise Saudi Arabia to my younger sets. Make your way to the A-list countries, US, UK, Australia, Canada. These are some of the places where at least you're free to practice whatever culture you want to practice. Saudi Arabia it's a lot more restricted, especially if you're a Christian. You're not allowed to practice your faith. Women have a lot of restrictions and all that, so it's not somewhere I would encourage as an A destination to anybody.
Okay, you just give a brief overview on the life in Saudi Arabia. Can you expatiate on an everyday life there? Like what I've experienced?
Well, the everyday life in Saudi Arabia was go to work and come back. Just like I said earlier, it's a whole lot different culture. It's not, for example, women cannot, in some areas, women are not even allowed to walk on the road without a companionship. A companionship meaning either their husband or their sons, accompanying them. So you won't be able to see any woman on the road. So there are no places of even socialization, plus the language barrier. They are very limited in English. As much as 90% cannot hear or speak English, or more than 90%. So basically, the everyday life, because of all these cultural restrictions, the everyday life was just straightforward: to work and come back, go to work and come back. There was nothing else to do there, really.
Biography though, with all this you have said, in your biography, you stayed there for a year. How were you able to manage?
I stayed there for about 2 years, and that is from 2020 to 2022, right? So, well, in terms of how I was able to manage, what really kept me going was the bigger picture. I knew why I went there in the first place. So while there, I just concentrated on writing my exams, because the PLAB 1 and PLAB 2 exams is not child's play, and as well as the English exams, that's your IELTS. So it was really what kept me going, because I had these exams I was really preparing for. So I had no time really to, think of anything else. So it was just exams, work.
Okay. Well, did you wish you knew anything before you left? Like, would you take the experience all over again? Like, did you wish you had any experience of this? Like, anything you wish you knew?
Before leaving Saudi Arabia?
No, before you went to Saudi Arabia.
Well, well, I knew there was nothing I didn't know about the place, so it wasn't. I heard so much about Saudi Arabia. Obviously, I had seniors there who was directing me, telling me and also giving me their experiences and all that. So it wasn't really a big shock to me. But, hearing about it is very different from experiencing it. You can hear about something and you feel like maybe no big deal, but then when you experience it, you see it's a whole lot different thing altogether. So really, I wouldn't say it was there was any particular information I would have wanted to know or not know or whatever. I knew what I was going into, and I don't have any regrets, going to Saudi Arabia. I don't have any regrets whatsoever going there. But just like I said earlier, it's not somewhere I would recommend as an A-list for the upcoming doctors.
Okay. Well, you said that it's only for those that need the income to write the plan. Is there anywhere else that offers that kind of luxury? Like you don't need any exam to write it.
Well, many of these Arabian countries offer such. Dubai, though Dubai in recent years you have to write certain exams to get it. Oman, Qatar, these Arabian countries. But as at that time, Saudi Arabia was the easiest to get into.
Okay. Well, you said that you're currently in the United Kingdom now, right?
Yes.
Okay, so can you discuss how you got in, starting from the visa process? Let's start the visa process first.
Well, obviously, the visa process did not get me into the United Kingdom. Visa? If you want to follow the pathway of United Kingdom, visa process is the least of your worries. The most important thing are your IELTS, PLAB 1 and PLAB 2. All right, and when you're able to scale through those exams, visa really is straightforward. When you've written those exams and then you get offered a job, with the job offer and all that, you're given the visa and you just travel. So visa process is not really what gets you into the UK. It is those 3 major exams: your IELTS, your PLAB 1 and your PLAB 2.
Okay, are those the only exams? You mentioned the IELTS, PLAB 1 and 2. Are those the only exams you need?
Yeah, those 3 are the only exams to get into the United Kingdom. Different countries have their exams. The US, the USMLE, obviously, the Australian exams and the Canadian exams. So those, each of those countries have their own pathways. And I'm sure that, you've already started this program. You should be able to reach out to we have some of our alumni who are in the US. You should be able to reach out to them, and they will also give you, tell you their experiences on how they got to the US. I don't know if I'm not sure at this point if we have any alumni in the other places like Australia or Canada. I'm not sure at this point. But I know that to get into Australia or Canada, if you write your PLAB 1 and PLAB 2, that is this UK pathway, and work for a year in United Kingdom, you can easily move to Australia or Canada.
Okay, so let's begin with the IELTS as the first exam. Is there I want you to just take us through the IELTS before we enter the PLAB 1 and 2. So the IELTS, what's the exam about?
IELTS is an English exam, and it's not just straightforward. I know it sounds easy when you say IELTS is an English exam, and most of us would like, well, I can speak English already, let me go and write it. But I know doctors who've written or who wrote IELTS 7, 8, 9, 10 times, all right, before they passed it. So it's much more complicated than just speaking English or just being able to write or even read. So it's IELTS is an exam that usually has 5 segments: listening, reading, speaking and writing, and you're tested in all these segments. There are specific and certain things that they are looking out for. I mean, it's easy to pass with dedication and practice, but at the same time, it's also very, very easy to fail, judging by the fact that, like I said, many doctors had to write it 4-5 average before they could pass it. Another alternative to IELTS. So personally, I did not write IELTS. There's an alternative to IELTS, which is the OET. The OET stands for the Occupational English Test. I think it's an alternative to IELTS. It's made up of the same segments. Your writing, your speaking, your reading, and all that. But the difference between the OET and the IELTS is that OET is more medically inclined, so it's easier for doctors, because IELTS, every other person writes IELTS, so it's just a general knowledge stuff. But OET is more like a medical, it's medically inclined. I mean, in the writing aspect, they tell you to, instead of like in the IELTS where you're just told to write maybe a composition or a letter or whatever on general knowledge, in the OET it's more like you're writing a referral letter to, you're a doctor and you're writing a referral letter about a patient to another doctor. So it's easier to do OET. The only downside to OET is that it is almost 3 times much more expensive than the IELTS. The last time I checked, with this dollar and pound variation, everything now in Nigeria, nobody knows the actual price. But as at the time I was writing the OET, if IELTS as at 3-4 years ago, I think it has increased now to about 100 and something thousand. But IELTS as at 3-4 years ago was about 75,000 to 350,000 for OET. So OET was about 3 times the price of IELTS. I don't know what specifically. I know the prices obviously will remain stable, but what I mean by prices is the Nigerian factor. Dollar rises and pound rises and falls every day. But I think your IELTS shouldn't be more than, or range, the range of IELTS should be about 125, 130,000 to about almost 400k of the OET. But like I said, when you consider the fact that, many doctors write IELTS 4-5 times, you see that in the long run, it's even cheaper to write the OET, because you just write it on the average. Most people write it once, you write it once. Not that I know people who's written the OET 2 times, 3 times, but on the average, the OET is easier to write once. It may be more expensive and all, but it's easier to write once than, the IELTS.
Okay. Just before we continue, please, if you have any other questions, you can try and see if we can type it into my direct messages on WhatsApp, so I can ask him directly. So you talked about the OET being a better alternative. You make it sound like it's a better alternative than the IELTS. Is that true?
Yes. As far as I'm concerned.
Okay, because actually this is even the first time I'm hearing about the OET.
Yeah, it's an Australian exam. It's an Australian version of the IELTS. You guys should, browse more and read more about it. It's, like I said earlier, it's a little bit on the costly side, but from a doctor's point of view, it's easier than IELTS. It's much more straightforward than IELTS, because you're being asked medical things. You're being asked to write or read about medical things, than IELTS, which is just about general knowledge and all. So yeah, OET is easier than IELTS.
Okay. Well, this OET does have an expiring date.
Yeah, most of them does. I think on the average is 2 years. By
for
2
the
years,
OET.
yeah, for the OET, by 2 years you should have, passed whatever exams you want to use it for. Lab 1, Lab 2, whichever one, you should have passed it. Then another thing I'm not sure is that, I don't think I'm not sure, it's something like I said, when you organize this discussion with my colleagues in the US and stuff, you ask them if the OET is a pathway for the USMLE. Okay. But the OET is an alternative to IELTS for the PLAB pathway for those guys who want to come to the UK. So, yeah.
Okay, well, one very important question is it advisable to take them one in school, this OET?
Yes. If you have your targets in sight, yes, why not? You can take it in school. By the time you get to your 5th year, final year, why not? You should be able to take it. I know many medical doctors who did not even do NYSC. It's up to them, it's their choice, individual variation, who did not even get to do their, NYSC. I mean, they write their OET or IELTS while in medical school. By the time they are entering into house job and completing house job, they write their PLAB 1 and PLAB 2. Immediately after the house job, they're outside the country. So the earlier, as long as you know that you have 2 years from the time you've written your OET to complete all these exams, yeah, why not? Go for it.
Okay, so I guess we're done with the IELTS/OET. I guess IELTS is out the window now. It's better that you do the OET. That's a very golden advice. If your friends are not here, tell them to come here. It's only IELTS that is in everybody's head apparently in this country. Well, the PLAB now. Next one is the PLAB 1, right?
Yeah, PLAB 1, yes.
Okay, so can you tell me how much does it cost to take the PLAB 1?
Well, the PLAB 1 is about, I think, 240 pounds, which when you convert it to Naira is about, give or take, 240 or 250,000 Naira. That's the cost of PLAB 1.
Okay. What about the curriculum? What's the cutoff mark?
The cutoff mark, so there's no, just like in your PLAB 2 as well, in PLAB 1, there's no cutoff mark. So the cutoff mark is based on the performances of everybody writing PLAB 1 on that particular day. All right, so if you're about 1,000 people writing the exam, the average is taken, and then, so what I'm trying to say is that for every PLAB 1, there are different cutoff marks, because the exam is usually over 180, right? So in a particular set, if the performance of everybody has been very, very high, the cutoff mark may be as high as 119 or 120. In another set, if the performance has been very low, the cutoff mark can be as low as 109, 110. So there's no actual cutoff mark to the exam. It's all dependent on the, number of students or doctors writing the PLAB 1.
Okay, that was actually very interesting to hear. I actually didn't know about that. The curriculum, what's the curriculum like?
The curriculum, like I said earlier, is just about everything you're doing now in medical school. So every knowledge you're assimilating now is not a waste. It's not just when you pass 4th MB, you throw away your pediatrics or throw away your O&G and all that. So every knowledge you're getting now is still going to play a major factor in your PLAB 1.
Sorry, Obina, you kind of cracked up there a bit. Can you rewind?
So I said that every knowledge you're getting now in medical school will still play a very significant role in your passing your PLAB 1. All right, your pediatrics, your O&G, your medicine, your surgery, your pharmacology, pathology, anatomy. That's Plab 1. Everything, everything is all those curriculum from your second year to your final year. Even community medicine, your epidemiology and all that stuff, you still do it in your Plab 1.
Okay. Then you said that the Plab 1 is encompassing everything that you have done in doing medical school, right?
Yes.
So what's the difference between it and the Plab 2?
So the Plab 1 is strictly an MCQ, a multi-choice exam, right? Strictly a multi-choice. It's strictly a multi-choice exam, MCQ.
Okay.
All right, that's your Plab 1. Well, your Plab 2 is strictly your clinicals. I don't know what you guys are doing now in your clinical exam. I think the OSCE, or is it the OSCE or the OSPE? But that's
they are still revising the pattern of it, but I think most of them are doing OSPE now.
Okay, so Plab 2 is just your purely your clinical exam. You get a patient, you take your history, do your examination, and manage your patient all within 8 minutes. With an examiner there watching you. So that's basically Plab 2. There is no MCQ or essay. It's just strictly your clinical exam. And in Plab 1, for Plab 1, you can do Plab 1 anywhere in the world. I mean, you have centers in Enugu, you have centers in Lagos, I think Port Harcourt and Abuja as well. But in Plab 2, for Plab 2, you can only do your Plab 2 in the UK. That's another difference between them. And then obviously the cost of Plab 2. Plab 2 is way more expensive than your Plab 1. Plab 1, like I said, is about £240, and you can do it in Enugu. You can write it in Enugu. For your Plab 2, the cost of your exam is about £940, which is give or take 1 million, just to write your Plab 2, and that's outside, your flight tickets to the UK, your accommodation on where you. So the average cost of everything you would require to actually write your Plab 2 maybe going nearer to 3 million or 3.5 million, depending on what the exchange rate is at the time you're ready to do it. So that was why I said many doctors had to take the Saudi Arabia pathway to go and make some funds to be able to write some of these exams, because they can be very expensive.
Yeah, it's actually quite clear right now how expensive they can be, to be honest. Yeah. Well, the Plab 2, does it also have a cutoff mark? Does it also have an average cutoff mark that they use?
Yeah. Just like I said, the cutoff mark is also based on the number of doctors writing the exam. You usually have you have to go through about 16 stations, 16 different stations, and you're required to pass 10. The minimum is 10, and then still it's not just enough to pass 10. You must still score above the daily average. Daily average is when you put together the number of doctors who wrote the exam on that day, an average is taken. So you must still score above that average, as well as pass at least 10 stations to be able to pass Plab 2.
Okay, so when you mean like pass 10 stations, you have to take your history, do the investigation, do the management, and the treatment. You have to get all those things right before they can give you 1 mark. Is that what you're trying to say?
No, one station is, for example, you have a station for malaria. So that station for malaria it's in 8 minutes. You should take your history, you should examine your patient, and you should manage that malaria in 8 minutes, and then you go to the next station. So that's one station. So the next station can be meningitis. The next station can be, convulsion, febrile convulsion, and all those things. The other, just like that. So you have to go through 16 different cases, all 8 minutes. You take your history and then you manage.
Wow. It sounds like something you have to take your time and prepare for before you pay your 3.5 million.
Yeah. You have to. I mean, for that, most people go through what we call academies. Academies is just more like lessons. They are usually paid academies. We have some of them in Lagos, Samson, to mention but a few, in Lagos, and I think on the average, Samson collects about £500, which is about 500k for a 2 weeks lesson. So it's Plateau is a big investment. It's not something you just wake up and then decide to go and do. It's a major investment. Are you there? Zeus?
Okay, can you hear me now?
Yeah, I can hear you, yeah.
Okay, I'm back. Sorry, please, can you start again?
So so I said Plateau is not something that you wake up in morning and decide to just go and do. The academy alone, that's, you have some centers in Lagos. The academy alone can cost up to about £500, and that's about 500k. It's usually a 2 weeks lesson. It's done. They have centers in Lagos, so you can imagine where the academy alone is just about 500k, and then you have the exam itself, 1 million. So you can see the price is going up, and that's outside flights, accommodation where you would stay here. And unfortunately, some people, after spending all that amount of money, they still fail the exam. So you can imagine a medical doctor or a registrar or a senior registrar, after years of saving up for that exam, then they just go and fail it. It can be devastating.
Wow, you have to actually take all this things very, very serious, right? What you just said now.
Yes.
But you said that you were in Saudi Arabia. You took the Saudi route of getting the money and writing the exam.
Yeah.
Right?
Yeah.
So did you register for any academies?
Yeah. While in Saudi Arabia, I registered for an academy, but I had to. Obviously, there's no physical academy in Saudi Arabia, so I did my academy online because there's an option to do it online. But it wasn't really easy because it's each day we spend about 12 hours. So you can imagine combining work, and then you work for about 8 to 10 hours, and you still had to sleep and all that, eat, and so it wasn't really easy for me because I was working. Academies are usually something you have to do full time for 2 weeks, But fortunately, we got there, so it's still doable.
Of course, you're living testament to that. So in the UK now, how are the work hours?
Well, it all depends on really the hospital, the type of hospital, the department you're working in. There's no specific work hour. Again, the contract, some of our guys working in the accident and emergency, they tend to work longer hours than those guys working in places like ENT, ophthalmology, and all that. So, like I said, it all depends on your specialty and department.
Okay, I've said that, but generally, what are the best specialties in the UK based on any
Well,
expenses, work hours?
there are no best specialties or worst specialties. The like I said, this profession is something that you must have to be passionate about it, before you venture into it. If especially practicing outside the country is really going to bring out, it's either going to spoil you or it's going to mar you. Because things are different here. It's not the same way we practice in Nigeria, that we practice here. There are lots of litigations and all that. You have to be careful in everything you do. So there's no really I wouldn't say there's any best, specialty or whatever. It all depends on you and what you want to do, really. We've just noticed there's a trend here that most Nigerian doctors, almost 60 to 70% of Nigerian doctors in the UK tend to, go towards what we call GP, general practice, which is equivalent of family medicine in Nigeria. So most of our colleagues here tend to go towards that because number one, it's the fastest. 3 years. If you do your residency for 3 years, then you become a GP consultant. So that's where most of our doctors tend to go towards. But then you still have many doing your surgeries and the obs and gynae and all those things. So it's all up to, it's an individual thing. There's no best or worst or whatever.
Okay, that was very, very insightful. But the work environment, how is the work environment?
Like I said earlier, you have to be careful. It's not Nigeria where everything goes. The kind of medicine we practice in Nigeria is doctor-centered, right? More like you're the doctor, you're in charge, you've made your diagnosis, and then you tell your patient what you want to do for the patient. It's completely different here. Here, the patient is in charge. You take your history, and then you tell the patient the management options. You can either decide to go take this drug for this, or this drug for this, or do surgery for this, or do this. It's up to you. Which one do you want? So you don't tell a patient what you're going to do as a doctor. Rather, you outline all the management options with their advantages and disadvantages, and then the patient tells you which one they prefer.
Oh, so I don't know that sounds better. It's just more sensible.
Well, it depends on how you want to look at it, because as a doctor, you may feel that management A is slightly better than management B as a doctor, but the patient feels that management B is better for him or her. So you just have to do it, because if you use the management A that you want to use as a doctor, and then certain mistakes or whatever come out from it, you're going to court. You're going to pay out your ass. So here it's more like like the system is more organized. There's this fear factor. Nobody wants to come out outright, as a doctor and say this is the best treatment for you. This is the best treatment for you. No, nobody wants to do that, or nobody does that. So I give you your management options. These are your options. You decide which one you want, so that whatever side effect comes out from it, the patient can say, yeah, I've made that decision, and and that's it. So here, the environment is just much more tensed up than you will get back home.
Okay, the preclinical students might not be able to relate to all these things we're saying, where the differences in how we do things here. Over here we tend to do it very, very anyhow. Like I see we're doing village medicine. And then you get what I mean.
Yeah. Yeah.
But
Obviously, I know what you mean, but
but I don't know. You as a doctor there now, yeah. How is it like your own well-being as a medical doctor in the UK compared to Nigeria?
Well, what do you mean by well-being? Let me understand your question very well.
How do they make it comfortable for you?
The truth is
like
that
your own lifestyle. How do they make your lifestyle comfortable? Like your work environment, you coming to work, you have an AC room, that kind of thing. Like I don't know whether I've been to the new A&E in Parkland. There's no AC in the consulting rooms.
Yeah, no, definitely.
So,
no.
If you can understand what services there.
No, definitely you can't. You can't have that. The patients, first of all, will sue the hospital for that kind of thing. The patient will sue the hospital. Yes, I mean, a patient can come in and sue the hospital. I mean, why don't you have lights or whatever? Yeah, like I said, patients have a lot of rights. Patients. I mean, here patients are the gods. They are treated like, it's not like, trust me, it's not like Nigeria. Here patients it's patient first. Practice outside the country is patient first. It's more like just like when you in Nigeria you have a supermarket or whatever in Ogbete or something, and then you're trying to attract customers. Everybody's trying to attract customers. So at that point, that customer is number one. So that's how practice in the UK is patient first. And obviously, everybody's well-being is taken into account. I mean, there must always be good working environment. And if there's no good working environment, there's always a system where you could report to the right channel that, whatever working environment is not conducive for you. For example, a consultant talks to you anyhow. I mean, those kind of things are not tolerated here. This kind of medical bully that we have in Nigeria, about seniors trying to look down on the juniors and whatever. Those kind of things are not tolerated here. There are channels where you can easily report that so and so person spoke to you in certain that person. Outside that, you just don't go beyond certain boundaries.
Wow. So it's a very litigious society. Patients are treated as clients.
Yes, as clients, as gods, whatever need they desire is first, is one. I mean, you don't have any choice. I mean, it's what they want that you give them. So it's completely different from, like I said, it's completely different from what we have in Nigeria, where as a doctor, I was the boss. I tell the patient, you have malaria, and I'm going to give you Coartem and paracetamol, and that's it. Do you understand? Here is different. I have to tell you, there are options for treating malaria. We have the tablets, we have the injections. These are the advantages of the tablets, as well as its disadvantages, and these are the advantages of the injections. So, which one do you prefer? The patient says, okay, I want tablets. And then you give patient tablets. You don't make decision for the patient. You don't.
Wow. These are
some of the things you'll be trained in. They'll be looking out for in your Plab 2 exams as well. These are some of the things you're going to be doing in your Plab 2 exams as well. So, yeah.
Okay, I was actually hoping that it's not like when you just pass your Plab 2 and you land in your office, you go and say, good day, ma. Okay, you gotta take this one. You gotta go to the pharmacy and buy this one. The next thing you see something on your table.
No.
Okay, they warn you about this kind of stuff before time.
Definitely.
Oh, that's very very good to hear. But generally though, like, how is life in the UK compared to Saudi Arabia?
Oh, of course, much. Can't compare the two. You can't compare the two. I mean, the society is a free society. Come on, everybody. Any society that You're allowed to express whatever you want to express. I mean, you can never get it wrong, right? As a Christian, I can practice my faith and all that. So I mean, you can't compare the two. The UK is much more, and then here is also the UK is multicultural. These days you meet a lot of Nigerians, blacks, different people from different parts of the world, so you can't compare the two. UK is number one.
Okay. Well, you said things about practicing your faith, and we do have some religious leaders that's school in our school. Do they have any churches for them, or are there any options for them in the Saudi Arabia?
No, there's nothing like church. You're not allowed to call anything that relates to Jesus in public. So there are no churches in Saudi Arabia. If you want to do, if it's also even against the law to do anything in the name of Jesus, even in whatever have any form of gathering. So you can't even, for example, say let you open a very small church in your room and people will come in and pray and all that. Some people do it, but it's also against the law. So if you do that kind of thing and you're caught, you face the law. So the summary is that you're not allowed to publicly do anything that concerns Jesus Christ in Saudi Arabia. So yeah, wow. It's a very restricted country.
I know that's called it bleak. But generally though, how do people actually fare there? Is that they just keep their mouth shut, go to work, come back?
Exactly. Kind of like I said, you have a goal. Many people there had a goal of, writing exams and leaving as soon as possible. So go in there, do your 1 year or 2 years at most, and get out.
Yeah. But in the UK though, it's a very culturally rich area.
Yeah.
Do you how is everything there for you? The community.
Awesome. Just like you've put it, it's culturally rich. So you have a bit of everything. The other day in Sunderland, though I didn't attend one of the cities, Nigerians did they celebrated the Jiofo, the New Yam festival. You understand? So you have everything. So you have people you can share your ideas and whatever differences you have. So it's anything unlike Saudi Arabia.
Wow. Well, I guess we have covered most of it. Is there any experience you want to tell us? Just anything you feel that would enlighten us more on this?
No, I don't have any particular experience apart from advice.
Okay.
Some of us didn't have direct mentors, and then we got advice from different places, and at the end of the day, before you find out the correct one you should follow, it's already late. So I would advise us to have mentorship. This profession is about mentorship. Even when you come over here, is mentorship. Have a senior who guides you and directs you on how to do this or how to do that. So the number one thing I would say is, number one, mentorship, and two, start early. If you've decided that you will practice your medicine outside the shores of Nigeria, start early. There's no point waiting for except maybe you have the obvious reason, which are the financial reasons. But if you don't, start early. There's nothing wrong in writing your IELTS or OET in your 5th year or final year now. You guys should be in your 5th year. There's nothing wrong in writing it now, because you have about 2 years before it expires. By the time you're graduating or just starting house job, you write your PLAB 1, right? And by the time you're finishing with your house job, you have your PLAB 2. Do you understand? It's now up to you whether you want to do your youth service or you don't want to do it. But I mean, start early. The earlier you start, the better. There's no point. Some of us wasted time before, we started the journey and all that. But, start early. That's my advice. Make your decision now and start early. Take that.
Okay. So I guess, I think I've covered pretty much all the important things. It's just time for questions from the audience. Hello? Dr. Obina?
Yeah, I'm open for questions. Yeah, definitely.
Okay, so the first question, what's the ballpark figure to move to Saudi?
What's the what?
So to move to the UK, like the total ballpark figure, because I think this person here, he's trying to get a total budget for what he's planning for himself when he's trying to move.
Based on the current exchange rates that you have now, everything is so expensive and all. So based on the current exchange rate, the minimum should be about minimum should be between let's call it at 4 mil.
Okay, I mean you can give the cost in pounds if you want to, just to make it.
I mean, you're not going to do it in pounds. You're going to do it in naira.
I mean, if it's we can do that ourselves. Okay. Mathematics.
So the OET cost about £320. At least I know someone who booked a couple of weeks ago, and that was about £326 or thereabout. Then you have your PLAB 1, which is about give or take £240. Then your PLAB 2 is between £950 and £960. So these are the three major exams. Then before you consider the other things like traveling expenses, your visa fees, your flight tickets, and all those things. Yeah, so.
Okay.
But give or take, if you're to estimate how much you would need in naira to cover all these things, you should keep about 4 mil.
Okay. So another question was, after the PLAB 2, would there be an automatic appointment to your hospital, or you write the applications yourself?
No, there's no automatic appointment. You have to write applications. You have to keep writing, and these days even people write over 150, 200 applications before they even get invited for an interview. So it's not
150 to 200.
Yeah, I know people who have written 150 over 152. I know people who wrote 10 and got interview in their first 10. I know people who have written over 200. They've not gotten any interview and all that. So it's luck, but you still have to apply. There's no automatic job waiting for you.
Wow. So after all the software, you have to now also job.
Definitely.
Market.
Some people, I know people who I wrote PLAB 2 together with, and till now they've not gotten jobs. And that's over a year now. They've not gotten jobs. They're still applying. So it's luck, really.
All right. Well, what is the current cost to get to Saudi at the moment?
Last time I checked, with interviews and agents, some of the agents that handled all those things and blah blah blah. Last time I checked, it was about 4 mil to 4.5 mil. Right? So I don't know what it is now. some people had it cheaper as at the time. I'm just saying the average that I know of. So that's about 4 mil now.
Wow. Oof. Like say we go walk this country tire before we ever see this place. So. Anyway, okay. So another question now. This is now coming from somebody. She's saying that you should throw more light on the OET exam and what it's involved in the exam, what it's all about.
So the OET exam is just like I said, it's similar to IELTS. You are being examined in 4 domains, which are your listening, where they're going to play. I don't know if you have any exposure to any of these at all, but it's more like you're going to be given a headset, and then you hear 2 people talking, and then you're given a sheet of paper with certain blanks at different places. So as they're talking, you have to be filling in those pieces of paper what they said. So they want to test the fact that you can actually understand English. So that's the listening part. And then you have the speaking part where, you'll be given a set of things to do or say, and then you're talking to an examiner who is there with you. They want to listen to your English and make sure that you can speak well. Then in the writing, you're given, it's more like you're writing a referral letter to another doctor. They'll tell you blah blah and blah that you are doctor this or doctor that. You have a patient who's coming with blah blah blah. Then you write a referral letter, I think not less than 250 or 300 words to another doctor. And then the other part is the reading part, where you're also given a series of compositions from a book, and you're to fill out certain blanks. So it's the total score for the OET is I think 400, and you have to score 250 to pass. Anything less than 250 is a fail in any of the bands, in the individual bands. That is in reading, in speaking, in reading. So each of those bands are scored individually. So if you score 250, in not 250, sorry, in 350. If you score less than 350 in any of them, is an automatic fail. So you have to score at least 350 in the whole 4 to pass the exam.
Okay. And it's also, can you write it before your PLAB 1? Are you meant to write it before your PLAB 1?
Yeah, you must. That's the first step. You must write it before your PLAB 1. Before you're allowed to book for PLAB 1, they must see your OET or IELTS results.
Can you write it in Nigeria?
Yeah, it's written in Lagos. And I think they've opened the current center in Port Harcourt. I'm not sure, but many of my friends who did, or colleagues who did, wrote it in Lagos.
Okay. Then there's another person asking the question about the accommodation situation in the United Kingdom. How is the cost of living there? And what's it like? And is there any help from the hospital that you're working for?
There's no help from anybody. You're your own. I mean, you're a doctor and you rent your house and you pay for your house. So the accommodation, it's the cost of living here at the moment is quite high. From the accommodation to all those things is really quite high, but it's not something that you cannot afford as a doctor. So it's not, as long as you're a medical doctor and you're working, you should be able to pay for accommodation. Yeah, some places are much more expensive than other places. Like many of my colleagues who live in London, pay as much as 1,800 to 2,000 pounds for a small 2 to 3 bedroom apartment. Whereas in the region where I'm in Manchester, for the same, we are paying 800 to 900. Yes, and so it's all region dependent, but at the same time, it's not something a medical doctor can't afford.
Okay, this is a personal question of mine anyway. I've noticed most of the doctors abroad, they went through student loans, and most of their salaries divert towards paying off those student loans, yeah? Is that an advantage for you as a Nigerian that you studied here and most of our education is affordable, no matter how meager it may look?
Yeah.
For you, is that an advantage, yeah?
It's a big, very big advantage, and that's why that's what most of our nonsense politicians are banking on, and they are saying that our medical education is really cheap in Nigeria, because truthfully, what these guys over here have to pay to get through medical school, they spend almost the first 2 years of their working as a doctor paying those loans off. So medical school in Nigeria, no matter how much you are paying, is way cheaper than what these guys are having to pay here. Yeah, so it's an advantage.
Okay, so can you, I don't know whether you're okay talking about this anyway. What is the monthly salary as a doctor in the UK?
Well, the monthly salary is also dependent on contracts, different people and level of experience. Different people earn, there's no, stipulated amount of salary this is what is being earned, except for those guys who have gone into training and residency. So at that point you're doing residency, yes, the salaries tend to be constant, but for every other person it's different. It's more like a range. So it can go up from 40,000 pounds in a year to about 65,000 pounds in a year for medical officers and all that. But by the time you start your training, that's your residency, it falls down to an average of, let's say, 48 to 50,000 pounds per year in the UK. So, but it's also important to stress that amongst these A-list countries that I mentioned earlier, the UK is the least paid, right? UK is the least paid. I mean, in doctors in Australia, Canada, United States, and triple the salaries we are earning here. So if you have your goal is to make money, then I would advise you start early and start chasing the USA, because that should be the top of the list.
Well, okay, somebody's also asking these same things now, yeah. But for the Saudi, how is the salary and the cost of living there?
The salary in Saudi Arabia is comparatively, when you compare it to the amount of work you do, as well as the number of hours you do, as well as the cost of living as well, the salaries in Saudi Arabia is better than that of UK, comparatively. But what Saudi Arabia does not have is what you call locums. You get? Locums is where you take up extra shifts. So in the here in the UK, we have locums. So I could take up extra shifts, and then by the time I do that, my salary eclipses what I was earning in Saudi Arabia. You get? But if it's for pound, that is when I say pound for pound, I mean the number of hours compared to the amount of job we are doing, compared to the cost of living as well. I think the salary in Saudi Arabia is slightly better.
Okay. So in Saudi Arabia, can you work in more than one hospital?
No, that's why I said you cannot, unlike in the UK where you can.
Okay.
Right? Unlike in the UK where you can.
There's a practice in Nigeria where you can substitute for your friend, or I don't know, and they'll give you some money for substituting for them. Can you do that in the UK?
You go to prison. You go to jail.
Are you kidding?
You go to jail. So all those kind of things are not mentioned here. You know.
Wow.
They're not mentioned here. Yeah.
Okay. Okay, so in the UK now, what are your expenses?
In cost of living, right?
Yes, your cost of living.
Oh yeah, like I said earlier, the cost of living is really high, from house rent to taxes in almost everything. You know, it's really quite high. The only good part about the UK is that at least the cost of eating food is much better than you would even get in Nigeria. So food and stuff is really quite cheap here, but every other thing, I mean, is just exorbitant. Your house rent, to your taxes, to your electric bills, water bills, everything. But it's still doable. It's not something you cannot afford as a doctor.
Okay. So basically, there's room to save.
Obviously, yeah, there's room to save, and because of the well, I shouldn't say fortunately, because it's still our country, but because of the very high exchange rate, even if you're able to save, let's say £1,000, maybe in a month after your expenses, you say, okay, let me save up to £1,000. Here, £1,000 it's nothing really. I mean, it's just barely enough to pay your rent. But by the time you send it back home, let's say, for example, you have something you're doing back home, that's £1,000 is over £1 million. So, yeah, in that sense, you can save. Definitely, yeah, you can save.
Okay. That makes a lot of sense. Well, there's somebody else that's also asking. You mentioned something about how we can easily locate from the UK to Australia. So what's the pathway?
The pathway is to write your PLAB 1 and PLAB 2, just like I've done, and then work for a year in the United Kingdom. Once you work for a year in the United Kingdom, you automatically qualify to work as an MO in either Australia or Canada without writing any of their exams. The other good part about it is that Canada and Australia also recognizes UK residency. So once you do your residency program here in the UK and become a consultant, you can easily get a job in Australia or Canada, but definitely not the US. US, whoever you are, you have to write their exams.
Okay. We'll think of someone that will cover that one. But is the process complicated? Also, let's know that.
For which one?
To go to Australia.
No, this is not complicated. Just this thing I've just told you now. Write your for now, I've qualified to actually apply for a job in Australia or Canada if I want. So just write your PLAB 1, PLAB 2, just like you're coming to the UK, work here for a year, and then you've automatically qualified to work in Australia and Canada. If you now go further here and do your residency here, you can easily, because it's much more difficult to enter the Australia or Canadian residency system. So I know many of my friends whose family are in Australia or Canada. What they do is to actually come here to the UK, and do their residency, become a consultant, and then go back to Canada or Australia. Because it's much more difficult to, integrate into the medical system of Australia or Canada, but it's easier from UK. So that's why many guys come here, do their residency here or whatever they want to do here in the UK, and then migrate to Canada or Australia.
Okay.
So currently, Canada and Australia are doing to the UK what the UK are doing to Nigeria. The medical drain. Everybody seems to be moving from UK to Canada or Australia.
Okay. That's, I guess whoever offers the best package for you now, right?
Yeah, definitely.
Is the job market. So someone is asking now if it's advisable to travel out immediately before doing the house job.
No, it's not, because you need without the house job, you cannot get your full registration to practice. The only thing you would have is your provisional registration, which is the one they will give you when you graduate. So you only get your full registration to practice when you've done your house job. You understand? So you have to do your house job, get your full registration to practice before coming out.
Okay. So another person's asking, how was medical life in Parkland?
Well, for me, medical life is we went through one of those sets, I think the 2008 sets to 9 and 10 sets, and maybe to an extent the 2011 set. We are this set that was, that was able to, we saw ESUCOM in two worlds. That is pre-ESUCOM before Professor Ugochukwu and ESUCOM after Professor Ugochukwu, because life in ESUCOM was just two different things. Before Professor Ugochukwu, then it used to be a very relaxed environment. Then we are much smaller than you would have now. We didn't have the now I'm sure you have the microbiology, biochemistry, I think pharmacy as well. Everybody, in Parkland now. So it's now a bustling environment. Then it was just the medical students, and we are small in number, obviously. So you can imagine I think we are the 6th set or so. So you can imagine where that amount of students occupying those hostels. So it used to be a very relaxed environment. Our rooms used to be awesome. We had ACs. We had our rooms used to be better than 5-star hotels. Trust me, it was a competition on whose rooms was finer. We had the biggest. You have guys having the biggest 42 inches or 58 inches televisions, DSTVs here and there, ACs here. So it used to be a very much relaxed environment until the Ugochukwu era. I'm not sure. Did you guys meet the Professor Ugochukwu era? Did you meet Professor Ugochukwu?
No, not at all.
Okay, yeah. So I think he took over as provost in 2015. He's late now, unfortunately. Took over provost in 2015, and that brought about that very serious and more medical school-like environment. Yeah, so it was just medical school for me. Was just there, just those two phases: the very relaxed phase, and then the serious phase, just like you have now, where it's all about exams, and this thing. But yeah, all in all, I thank God it was nice.
How was the lecturer experiences? I know you are the course rep, so you would have a lot to say about that.
Yeah, so just like I said, we are just coming to being a class rep. The time I took over was it was sort of challenging because we are just coming out from coming from, a pre-Professor Gochu era where, lectures were not as, frequent, or shall I use the word frequent or serious as it should be. Exams were not written as fast as, as at when it's due and all that. So the time I took over as class rep, the Gochukwu era, it was, a little bit more challenging for the lecturers. Everybody had to sit up. The lecturers had to sit up, come for lectures when you're supposed to have lectures. Students had to sit up, and all. So it was, like I said, it was a good experience. Different from what you guys would have now, but yeah, it was a good experience.
Okay, everybody, send your questions to my direct messages. So the Saudi now, can you just run it down just one more time for those that were not here in the beginning? The process, if you want to summarize it.
Yeah, the process, like I said earlier, is to wait for applications. They usually come up with applications every now and then. Look out for the applications, apply. And whenever you're invited for interviews, attend your interviews and pray for a job. That's just the summary.
Okay. Then the language barrier, somebody is asking. The language barrier, are there interpreters for you?
No, they were not interpreters. Initially, what the interpreters were your nurses. Then you had a lot of Indian or Filipino nurses who had worked in Saudi Arabia for years and years, some of them 20, 25 years. So when you had to see a patient, you just had to beg them because they had their own jobs to do. So you just had to beg them. You see, I'm new here. I don't understand what this person is saying. And then they'll help and interpret for you. But then you should be up on your game and learn the language at least by your third to fourth month. You should be able to, speak Arabic, or at least get to understand most of the major symptoms you'll be seeing in the hospital, like fever, vomiting, and all those things. Learn those basic, words, and then use your cut and join Arabic and get your way through seeing a patient. So yeah, you have to. It was really challenging in the beginning, but I had to just learn the language.
Okay, so someone is asking now, moving to Australia from here, that's Nigeria, is it very feasible? How easy will it be?
Well, they have their own exam pathways as well, which, like I said, I'm not very sure of, because I'm not sure there's an alumni from our school who went through that pathway. But they also have their own pathways, just like you would have your PLAB and all that. But I am not very sure of that now, so I cannot comment. The only thing I can comment on, going to Australia from UK.
Okay, that's no problem now. That's not even the discussion for the day. So the Saudi now, I think most people are asking, let them start preparing their money. For you to get there, you have moved to get there. How much are you expected to save to have your accommodation ready for you as you land there? Because you don't float in the air.
Where, in the UK?
Saudi.
Okay, Saudi most of the time when you get to Saudi Arabia, or when I don't know what's going on now, but when I got to Saudi Arabia, the Ministry of Health had like a temporary hotel, where they would organize for you and keep you in the hotel. And while you're in that hotel, you go about looking for accommodation. So I stayed when I got in, I think I stayed in a hotel for about 2 weeks. And then within that 2 weeks, I was able to meet up with a landlord and, move in. Fortunately, most of the landlords are very, very flexible, which means they know that most of us don't or haven't started earning salaries now. So what they do is that they allow you to move in, and then ending of the month, once your salary comes in, you pay them. But like I said, for younger sets, just like I keep emphasizing on that, for younger sets and all that, make your way to the UK and the US. Saudi Arabia is not somewhere I would put in the A list. I'll give it a B. Amongst all
You said B before, sir.
I said B. No, I said I'll give it a B. So
okay, but you said somebody's asking though, that culture shock. I think they are more interesting. Like, what was the experience that made you feel that culture difference? Like a person.
Is that not enough? Is that not enough? I mean, the wife is dying, and you're trying to examine the patient, and he's more interested in covering up, making sure you don't see her legs. I mean, what the hell am I doing with looking at someone's leg? You know, covering up the leg, like, you know, trying to. And this woman is dying. I'm trying to save her life. Doesn't care. He just. I mean, I've seen in my region, because usually, it's they employ female doctors to work in the obs and gynae, you know, the labor ward, you know. But in my hospital, they were short-staffed in, with female doctors. So they employed some male doctors who were working in the labor ward. And then, but then the labor ward was just completely hidden, you know. So one of the days, the male patient was, I don't know how he got in, you know, got into the labor ward, and the door opened slightly, and then he saw that he was a man taking the delivery of his wife. And, you know, he took note of the man's face and all that. And 2 days later, when the doctor was walking to the hospital, the man just stopped by, brought out his gun and shot him. You know,
Wow.
killed him off, yeah. An Egyptian doctor. So they are that jealous. Saudi Arabian men are that jealous and, you know, protective of their women. You don't just, like I gave you the example. I mean, someone is dying and he's more interested in covering her up. He doesn't want you to look at her legs, or not to talk of examine if she has a breast mass, and you have to examine the breast mass. I mean, you're dead. You're dead if you try it.
Well, you stayed there for 2 years. Like, how are you managing? Like, you're still alive, bro.
Like I said, whatever you're doing, you just have to be careful. You don't examine a patient without a chaperone. So whenever I had a patient, you know, I had to make sure that I had nurses with me, you know, seeing what I'm doing, so that tomorrow one of the patients will not come out and say I touched her in a certain place or whatever. So you must have a chaperone to be with you. And yeah, once you do all those things and you're careful, do your job carefully and all that, and consciously, you know, knowing their culture and all that, even when you're examining a patient, I mean, someone tells you a female tells you she has stomach pain, you don't just go and, you know, carry your hand and just start touching the stomach. You know, you have to sort of, if the husband is there, sort of use eye contact to take permission. You know, am I allowed that I want to examine your wife's tummy? You know, am I allowed to, you know, and then with eye contact as well, he can give you go ahead, you know, to do it. If he doesn't give you the go ahead, you can just go and beg a female doctor, you know, to come around and help you examine a female patient. So you just find your way around. You just had to adapt. You know, you just had to adapt.
Well, Nigerians are adaptable people, apparently.
Definitely.
So it seems like there's an absence of questions, and I've gotten to about 1 hour 34 minutes so far. So I really appreciate everything. Is there any final last words from you before we leave?
The final word, I've said it earlier, which is there's nothing more important than making that decision early and starting early. You know, you notice that you find out many medical doctors and all that, as at the time of graduation, they don't even know what they want to do with their life. You know, whether they want to, or even what part of medicine they want to go into, whether they want to do pediatrics or whether they want to do whatever. They're just so docile or dormant about their ambition. So my advice for you is now start now to make that decision for yourself. Decide what you want to do and start early to start working towards it. There's no advice that will supersede that. You know, the earlier the better.
Wow. Well, you have heard it here, folks. our own chief, Dr. Bin Arizona, has done everything for us, and it was.
Chief. They do that thing here.
Sorry, now I don't know. Wait, they don't do chief there too.
They do that thing here. Who be your chief?
Even here, we call our students chief, our senior students chief.
Nobody, you call your consultant by his name. If you call him by his name, if he's Adams, you call him Mr. Adams. You come and see your patient. Nobody is everybody.
Are you kidding? Anyway, well, really appreciate him for everything, honestly. It was not easy setting this up and him taking his time to do all this. Well, really thank you. So we just want to make sure that just wanted to say that the whole of ESUMSA and the other medical students outside ESUMSA that are here, we really appreciate you and everything you have done for us and you're still doing for us. Really appreciate you, sir.
I'm honored and glad to be here.
Thank you, sir.
So I'll just advise you make efforts to also reach other. Like I said, this profession is about mentorship. Meet try and invite other colleagues from different parts of the world to come in and share their own ideas and advice. And I mean, you can never know where you would get your life-changing advice from. So nice one.
Honestly. And there's a lot of life-changing advice here. Well, thanks a lot, sir. We'll meet again, sir. Thank you.
All right. Bye. Yeah.
All right, everybody. Thank you all of you for thanks to all of you for listening. We had a lot of participants here. Out of the 100 and something people that came, we counted up to 45 at some point. And I can bet you now that there'll be more. All right. Just know that there'll be recorded. There's a recording of this. I'm going to edit it and make sure that everything is congruent. I'm going to post it as a podcast for those that want able to make it. All right. Maybe they'll tell me this one they're not able to make it anyway. So I really appreciate you guys. Everything's recorded for your listening. Anytime you want to listen to it, it'll be there for you. 2 years from now, they'll be there. Thanks all of you for submitting your questions. And Pascal, you say you want to talk? Okay. Let's see what Pascal has to say anyway. Pascal, he has run. Anyway, thanks to all of you. See you meet again. I'm forever yours, Edeh Chidera Zeus, ESUMSA Treasurer. Goodbye.